Hi everyone, this is Caitlin Green, and I'm going to be presenting what would be week 4 of a telemetry interpretation for the registered nurse class. And this week's topic will be normal sinus rhythm and sinus node arrhythmias. The weekly learning objectives for the 4th week of class would be that students will employ a systematic approach to interpret and analyze EKG rhythm strips. Students will interpret and analyze rhythm strips for normal rhythms and sinus node arrhythmias. And students will explain causes, significance, signs and symptoms, and interventions to manage sinus node arrhythmias. In order to recognize arrhythmias, we have to be able to recognize a normal cardiac rhythm. Normal sinus rhythm occurs when an impulse that begins in the SA node or sinoatrial node progresses to the ventricles through a normal conduction pathway. It represents a normal impulse conduction through the heart, and this is the standard against which all other rhythms are compared. So on this slide we see a rhythm strip that shows how normal sinus rhythm appears. And the bottom portion of this slide shows the characteristics of the rhythm and follows the same steps of interpretation that we'll be using from this point forward to analyze and interpret all of the rhythm strips. And assuming that most of us don't carry calipers around all the time to interpret our telemetry strips, I find that a piece of paper works just as well. And you can use it to mark the distances between intervals and measure out wavelengths and march it out across your strip to determine similarities and differences. So we'll look at this strip and we'll use our steps of interpretation and we will be able to determine that this is in fact a normal sinus rhythm. So a few reminders before we begin here. This portion of the EKG complex is the P wave. This is your QRS complex. And this is your T wave. And each of these small boxes is 0.04 seconds. So we'll be adding those to find the lengths of certain intervals, certain complexes. So for this strip, when we start our interpretation, we're going to march out our distance between each P wave. And we're going to find that all the way across the strip, the distance between all the P waves is the same, which means that we have a regular rhythm. And to determine our rate, we're going to be counting the number of QRS complexes, and we're going to be multiplying those times 10 because we have to remember this is a 6-second strip. All of our strips are going to be 6 seconds long. So we have 7 QRS complexes, and when we multiply that times 10, we get a heart rate of 70 beats per minute. And that falls right within our normal parameter here. Then we're going to be looking at our P waves, and we're going to be seeing that all across the strip, P waves are present, they're upright, there's one in front of each QRS complex, and they're all similar size and shape. Next, we're going to be looking at the PR interval, which is the distance from the beginning of the P wave to the beginning of the QRS complex. And we can see that this takes up 4 small boxes. So we know that each one of those is 0.04 seconds, so our PR interval is 0.16 seconds. And because our range is 0.12 to 0.20, that's in the normal range. Next, we're going to look at our QRS complex and measure that distance. And we can see that that takes up 2 boxes. So our QRS complex is going to be 0.08 seconds. And that falls right within that normal range of 0.06 to 0.10 seconds. Next, we'll look at our T waves. And we can see that there's a T wave present with each EKG complex here. And none of them appear to be peaked, and none of them appear to be inverted or upside down. And lastly, the QT interval from the beginning of the QRS complex to the very end of the T wave measures out to be 10 boxes, which means it's 0.40 seconds, and that falls right within the normal range of 0.36 to 0.44. So all of the parameters here are normal, which means this is definitely a normal sinus rhythm strip. So let's practice again. We're going to use our paper, and we're going to march out the distance between all of our P waves, and we'll see that all the way across the strip they measure out to be the same distance apart. So we can determine that this is a regular rhythm. When we calculate out our beats per minute, we count 8 QRS complexes, and again we're going to multiply that times 10. We're going to get 80 beats per minute. Looking at our P waves, we can see that there are P waves present in front of each QRS complex. They're all upright, and they're all the same size and shape. Next, we'll look at our PR interval. And we'll see that the distance here is 4 boxes, which means our PR interval is 0.16 seconds. And this is normal because it falls in that 0.12 to 0.20 second range. Looking at the QRS complex, we can see that it takes up not quite 3 boxes, more like 2.5. So it's going to be 0.10 seconds, and that's again right in the normal range of 0.6 to 0.10 seconds. And then we'll look at our QT interval, and we can see that this takes up 9 boxes, which is 0.36 seconds, and our normal range is 0.36 to 0.44 seconds. And we can see that we have T waves across the strip here, no peaks and no inversions. None of them are upside down. So since everything is normal, this strip indicates that the patient is in normal sinus rhythm. Now that we know what is normal, we're going to switch gears and we're going to talk about sinus node arrhythmias. And these rhythms also originate in the SA or sinoatrial node, which acts as the primary pacemaker of the heart. And the sinus node is innervated by the autonomic nervous system through the vagal nerve, also a parasympathetic nerve, and several sympathetic nerves. So stimulation of the vagal nerve decreases the SA node firing rate, and stimulation of the sympathetic system increases the firing rate. Changes in the automaticity of the sinus node, as well as alterations in blood flow, and the autonomic nervous system influences may all lead to sinus node arrhythmias. So we'll be talking about sinus arrhythmia, sinus bradycardia, and sinus tachycardia, as well as their causes, their significance, signs and symptoms of each one, and interventions to manage those. So sinus arrhythmia results from an inhibition of reflex vagal activity or tone. During inspiration, an increase in the flow of blood back to the heart reduces the vagal tone, which increases the heart rate. And as a result, on telemetry, the EKG complexes occur closer together, shortening that P to P interval. During expiration, venous return decreases, which results in increased vagal tone, slowing the heart rate, and lengthening the P to P interval. Sinus arrhythmia can occur normally in athletes, children, and older adults. However, it rarely occurs in infants. So we'll analyze this strip, and we're going to use our steps of interpretation and determine each of the characteristics about the strip. So when we march out our distance between the P waves, we can see that they're shorter here, but then towards the middle of the strip they get much longer. So we can see that this is an irregular rhythm, and it also means that we can rule this out as a normal sinus rhythm. When we calculate the rate, we know we're multiplying the number of QRS complexes times 10. And we have 8 QRS complexes here, so our rate is 80 beats per minute. So it's not a bradycardic heart rate and it's not tachycardic, but it does appear that something's happening to make the heart beat faster and then slower in a pattern formation, and sinus arrhythmia does in fact vary with respiration. There are P waves across the strip, one in front of each QRS complex, and they're all upright, and they're all similar shapes and sizes. When we measure our PR interval, we can see that it takes up 3 small boxes, so it is 0.12 seconds, right in that normal range. And the QRS complex takes up 1.5 boxes, so it's 0.06 seconds, which falls right again in that normal range. There are T waves across the strip, and there don't seem to be any peaks or inversions. And the QT interval measurement takes up 9 boxes. which is 0.36 seconds, right within that normal range. So we can see that everything is normal except for the rhythm, which is irregular. So that means to us that this strip is that of a patient who is in sinus arrhythmia. So some causes of sinus arrhythmia include heart disease, inferior wall myocardial infarction, certain drugs like digoxin and morphine, and conditions that cause increased intracranial pressure. While sinus arrhythmia generally isn't significant and doesn't produce any signs or symptoms, some that could possibly be noted include CNS changes, like syncope and dizziness, palpable changes in the patient's pulse that increase during inspiration and decrease during expiration, and signs and symptoms that may be related to underlying causes. As far as interventions for sinus arrhythmia, there is no treatment unless the patient is symptomatic. And if it's unrelated to the respirations, then the treatment will be for an underlying cause. So we'll continue to observe the heart rhythm and determine its association with the respiratory cycle on telemetry. We'll analyze another strip here for practice. So we see here that the distance between our P waves definitely varies. It looks shorter in the beginning and then it seems to lengthen, and then it gets shorter again. So we know that this rhythm is irregular. Our rate, based on the number of QRS complexes, again multiplied times 10, is 90, which is normal. We can see that there are P waves, one before each QRS complex, all the way across the strip. They're all upright and they're all similar shape and size. And when we count the number of small boxes that are occupied by the PR interval, we get 4. So our measurement is normal. It's 0.16 seconds. When we look at our QRS complex, we can see that it takes up 2 boxes, making it 0.08 seconds, which is normal. And we can see that there are T waves present across the whole strip, and there are no peaks or inversions. And finally, our QT interval appears to be 9 small boxes long, so that's 0.36 seconds, and we know that this is a normal measurement. So all of the characteristics are normal for this rhythm strip except for the rhythm, which is irregular. So we know that this is from a patient who is in sinus arrhythmia. So now we'll talk about sinus bradycardia. Sinus bradycardia is characterized by a sinus rate of less than 60 beats per minute and a regular rhythm. And it usually occurs as a normal response to a reduced demand for blood flow. So we'll look at this rhythm strip and we'll go through the steps of interpretation. So we can tell when we march out our distance between the P waves that it is the same length all the way across the strip, which tells us that we have a regular rhythm. And when we count our QRS complexes to get our rate, multiply that times 10, we have 50. And we know that this is slower than our parameter for normal sinus rhythm, which is 60 to 100. The P waves across the strip are all upright. There's one before each QRS complex, and they're all similar size and shape. The PR interval measures 5 boxes, which is normal, and that falls within that 0.12 to 0.20 range because it's 0.20 seconds long. The QRS complex is 0.10 seconds, which is within that normal range. And it takes up 2.5 small boxes. The T waves are present all the way across the strip, and they do not appear to be inverted or peaked. And finally, when we look at our QT interval, we can see that it takes up 13 boxes, so it's 0.52 seconds. And we know that this is slightly longer than normal because our normal range is 0.36 to 0.44 seconds, but it's not considered an abnormal finding to have a prolonged QT interval in sinus bradycardia. So everything here appears to be normal except for our rate, which is less than 60 beats per minute, and a slightly prolonged QT interval, which is 0.52 seconds. So we can conclude this is a patient who is in sinus bradycardia. So some causes of sinus bradycardia include sleep, persons with well-conditioned hearts, such as athletes, some non-cardiac disorders, such as hyperkalemia, conditions that cause increased intracranial pressure, hypothyroidism, and hyperthermia. Also, increased vagal nerve stimulation or decreased sympathetic stimulation. Certain drugs, including beta blockers, calcium channel blockers, digoxin, lithium, and antiarrhythmics. And also cardiac diseases, such as SA node disease, cardiomyopathy, myocarditis, and myocardial ischemia. So the significance of sinus bradycardia depends on the rate and the symptoms. And sinus bradycardia occurs normally in many athletes because they have well-conditioned hearts, and it also occurs normally during sleep. If the patient's asymptomatic, they won't require any kind of treatment. We will just continue to monitor them. However, if they are symptomatic, they require prompt treatment. And if they have a cardiac disorder, they may not be able to compensate for the drop in rate, and that's what creates those symptoms. And prolonged sinus bradycardia may predispose some patients to more serious rhythms. Signs and symptoms of sinus bradycardia usually don't occur. You will be able to palpate the pulse at less than 60 beats per minute. And if a patient does show symptoms, they may include CNS changes, like dizziness, blurred vision, altered mental status, and syncope, hypotension, chest pain, cool, clammy skin, crackles and dyspnea, the third heart sound on auscultation, and palpitations and pulse irregularities. If the patient is asymptomatic and the vitals are stable, we won't have any interventions other than to continue to monitor the patient and review their medications for a possible cause. If they are symptomatic, we need to identify and treat the underlying cause. The heart rate may need to be maintained by a transcutaneous pacemaker, and the patient, depending on the rate, may possibly need a permanent pacemaker. We also may need to administer medications to speed up the heart. So let's practice again. Marching out our distance between our P waves on the strip, we can see that they're all an equal distance apart. So that tells us that we have a regular rhythm. And our rate, based on the number of QRS complexes times 10, gives us 40 beats per minute. There are P waves present in front of each QRS complex, and they're all upright and all similar size and shape. Our PR interval appears to take up 4 boxes, so that's a measurement of 0.16 seconds, which we know is normal, right, because it falls within that 0.12 to 0.20 second range. Our QRS complex takes up 2 small boxes, so we know that this is within the normal range. It's 0.08 seconds, and it falls within that 0.06 to 0.10 second range. And there are T waves present across the entire strip, and they are not peaked and they're not inverted. And finally, the QT interval measures 9 boxes, which is 0.36 seconds, and that's within the normal range of 0.36 to 0.44 seconds. So we have a heart rate of 40 beats per minute, which is slower than our normal parameter, and everything else is normal, indicating to us that this is a rhythm strip of a patient who is in sinus bradycardia. So now we'll talk about sinus tachycardia. And sinus tachycardia may be a normal response to exercise or stimulation of the sympathetic nervous system, which can be caused by stress, pain, fever, fear, anxiety, or any other strong emotion that the patient may be having. So looking at our characteristics and going through the steps of interpretation, we can figure out that this is a sinus tachycardia rhythm strip. We're going to measure the distance between our P waves across the strip. And we can tell that they're normal all the way across. They're all the same distance apart. So that tells us we have a regular rhythm. And our rate, based on the number of QRS complexes, is greater than 100. We have a total of 13 QRS complexes, so that gives us a heart rate of 130 beats per minute. And that's outside of our 60 to 100 beats per minute parameter. There are normal P waves all the way across the strip. There's one in front of each QRS complex, and they're all upright and the same size and shape. And our PR interval measures 4 small boxes, which is 0.16 seconds, and falls right in that normal range of 0.12 to 0.20 seconds. The QRS complex is 0.06 seconds because it takes up 1.5 small boxes, and we know that this is normal. When we look at the T waves, we can see there's a T wave across the strip. There are no peaks and no inversions. And last, our QT interval. When we measure that out, we can see that it takes up 7.5 boxes, which comes out to 0.30 seconds. And this is shorter than our parameter of 0.36 to 0.44 seconds. Just as a prolonged QT interval is considered normal in sinus bradycardia, a shortened QT interval is considered a normal finding in sinus tachycardia. So based on our interpretation, we know that we have a rate that's outside of our normal range. It's over 100 beats per minute, and we have a slightly shortened QT interval, making this the rhythm of a patient who is in sinus tachycardia. So let's talk about the causes of sinus tachycardia. In addition to those causes that were discussed on the previous slide, sinus tachycardia can also be caused by certain cardiac conditions, including heart failure and cardiogenic shock, also pericarditis. Non-cardiac conditions including shock, anemia, respiratory distress, pulmonary embolism, sepsis, and hyperthyroidism, and certain drugs such as atropine, dobutamine, epinephrine, and amphetamines. If the patient is using alcohol, caffeine, nicotine, or illicit drugs such as cocaine, that can also cause sinus tachycardia. The significance of sinus tachycardia depends on the underlying cause, and if it's related to exercise or high emotional state, it's not significant. But persistent tachycardia in the presence of a heart condition such as aortic stenosis or hypertrophic cardiomyopathy may signal impending heart failure or shock. And it can lower the cardiac output by reducing ventricular filling and stroke volume, and this can cause hypotension and decrease peripheral perfusion. And this can worsen myocardial ischemia by increasing the heart's demand for oxygen. And it can cause angina in patients with coronary artery disease. So usually patients that have sinus tachycardia will be asymptomatic unless their compensatory mechanisms fail. They may have a palpable pulse over 100 beats per minute, and they may have symptoms like CNS symptoms such as blurred vision, nervousness, anxiety, and syncope. They may have dyspnea. They may have chest pain and palpitations. They may be hypotensive, and they may have symptoms of heart failure like lung crackles, an S3 heart sound, and jugular venous distension. When treating an asymptomatic patient, the focus is on determining the cause for the sinus tachycardia. And when treating a symptomatic patient, we focus on maintaining their cardiac output, tissue perfusion, and correcting the underlying cause. So we want to check the patient's level of consciousness, provide a calm environment. We want to assess them for signs and symptoms of angina and heart failure. We may have to give them drugs to slow their heart rate. And we want to check their medications for a possible cause. And you can also question your patient about potential triggers like caffeine consumption, nicotine use, etc. So let's practice again. When we march out our P to P wave distance on the strip, we can see that it's the same distance between each P wave all the way across the strip. So we know that this is a regular rhythm. And when we count our beats per minute, we get 120 beats per minute. The P waves are all the same size and shape across the strip. They're all upright, and there's a P wave in front of each QRS complex. And the normal range for our PR interval is between 0.12 to 0.20 seconds. And this one takes up 3.5 small boxes, making it 0.14 seconds. The QRS interval is 0.06 seconds because it takes up 1.5 small boxes. We know that this is normal. And there are T waves present without peaks and without any inversions all the way across the strip. And last, we look at that QT interval. We can see that it is 0.20 seconds. It takes up 5 small boxes. And we know that this is shortened compared to our normal 0.36 to 0.44 second interval. So with a heart rate over 100 beats per minute and a shortened QT interval, these are the only characteristics outside of the norm. We know that this strip is from a patient with sinus tachycardia. So now that we've discussed normal sinus rhythm and some of the sinus node arrhythmias, we're going to practice our interpretation skills over the next 4 slides. And this is going to help prepare you for your practice when you're analyzing rhythms for your patients who are on telemetry. So we'll go step by step through the practice strips and keep in mind our normal values, and we'll determine what rhythm each patient is experiencing. So for this strip, when we march out our P to P interval distance, we can see that it's the same all the way across the strip. So we know that we have a regular rhythm. And continuing with the QRS complexes, we count 5 of those, so we're going to multiply those times 10, which gives us 50 beats per minute. And we've got each P wave for QRS complexes all the way across. They're all upright and they're all the same size and shape. When we measure our PR interval, we can see that it takes up 5 boxes, putting that measurement at 0.20 seconds. The QRS complex takes up 2.5 boxes, which measures 0.10 seconds. We can see that we've got T waves all the way across the strip, and there are no peaks or inversions. And last, we look at that QT interval, and we can see that that takes up 10 boxes, making the measurement 0.40 seconds. So when we put everything together, we have a regular rhythm with normal P waves, normal PR interval, normal QRS complex, normal T waves, and normal QT interval with a slowed rate of 50 beats per minute. So if you come up with sinus bradycardia, you are correct. So let's practice again. We're going to march out the distance between our P waves across this strip, and we can see that there seems to be some variation from the beginning to the end of the strip. We find that some of the P waves are closer together and some of them are more distant from each other, so our rhythm is irregular. And it does appear that it slows and then quickens and then slows again in a pattern formation. So you may be quick to say that you know what rhythm this is based on what we've talked about so far, but we do need to make sure we go through the rest of the steps of interpretation in order to make sure we're correct. So next we'll count the QRS complexes and multiply those times 10, and we get 70 beats per minute. When we look at each P wave, there's one before every QRS complex. They're all upright, and they're all similar shapes and sizes. The PR interval takes up 4 boxes, which gives us a measurement of 0.16 seconds. When we measure our QRS complex, we see that it measures 1.5 boxes, so it's 0.06 seconds. And the T waves are present across the strip without any peaks or inversions. Finally, we look at that QT interval. We can see that that's 9 boxes, which is 0.3 seconds. When we put that all together, we have a heart rate of 70, normal P wave, normal PR interval, normal QRS complex, normal T wave, and a QT interval that's normal with an irregular rhythm. So this all indicates to us that we are looking at a strip from a patient who's in what rhythm? If you said sinus arrhythmia, you're correct. We've got two more practice strips. So we'll go through the steps of interpretation again for this strip. And we'll march out the distance between each of those P waves, and we'll see that we have the same distance between each P wave all across the strip here. And when we count our QRS complexes and calculate our heart rate, we get 70 beats per minute. And the P waves on this strip are present before each QRS complex. They're all upright and they're all the same size and shape. And when we measure our PR interval, we can see that it takes up 4 boxes, which is 0.16 seconds. And our QRS complex takes up 1.5 boxes, so it's 0.06 seconds. And the T waves all across the strip show no inversions, no peaks. And then last, that QT interval takes up 9.5 small boxes, so that's 0.38 seconds. So when we put that all together, we have a regular rate at 70, a regular rhythm, normal P waves, a normal PR interval, normal QRS complexes, normal T waves, and a normal QT interval, which means that everything is normal on this strip, so it's from a patient who is in normal sinus rhythm. Last practice strip. So here we find that we have a regular rhythm because each of our P waves are the same distance apart all the way across the strip. And when we calculate our heart rates, we see that we're at 110 beats per minute. Looking at the P waves here, we can see there's one in front of each QRS complex. They're all upright and they're all a similar size and shape. Measuring our PR interval, you can see that this takes up 3.5 small boxes, making it 0.14 seconds. And our QRS complex measures 1.5 boxes, or 0.06 seconds. All of the T waves are present all the way across the strip. There's no peaks or inversions. And lastly, the QT interval measures 0.34 seconds. So when we put that all together, we have a regular rhythm, normal P waves, normal PR interval, normal QRS complex, normal T wave, and a QT interval that is slightly shortened with a rate that is greater than 100 beats per minute. If you're thinking sinus tachycardia, then you are correct. So in summary, today we talked about normal sinus rhythm and sinus node arrhythmias. We also discussed the causes and significance, as well as the signs and symptoms and interventions for the sinus node arrhythmias. And using our steps of interpretation, we analyzed several rhythm strips for each one of the rhythms that we discussed. This concludes this class session. Now you'll be expected to complete both a memory matrix over the content, as well as a multiple choice quiz. These are the references that I used in creating this class session. Thank you for watching.